Would you let an unqualified dentist remove your tooth? I bet not. Yet, many times we get eye exams without finding out who is examining us, what their qualifications are, and what their field of competence is. This can lead us to poor prescriptions, it can lead us to misdiagnoses, inappropriate referrals, and delayed treatment because of delayed diagnosis. So what should you look out for? You should ask about the qualifications of the practitioner that is examining you. A competent practitioner will find no trouble in telling you what their qualifications are, what their training is, and what their level of competence is. The other thing you should look out for is the equipment present. So next to the eye professional is equipment. So a proper eye exam involves a number of instruments, and without proper instrumentation, it's almost impossible to deliver a full eye exam. So one category of instruments that you should see, which is of course the most common ones, are the refraction equipment. So you'll find trial lenses, you'll see trial frames, you'll see retinoscopes, maybe an autorefractometer. So those are instruments for refracting. You will also see a vision chart or a vision screen or whatever is used for assessing your vision. But in addition to all those, there should also be instruments for assessing eye health. So this can be as simple as a direct ophthalmoscope, but it can also be other instruments like a binocular indirect ophthalmoscope, like a slit lamp, and also imaging instruments like an OCT or a fundus camera. Now, not all these instruments are always required, but there should be instruments, at least one instrument in each category of instruments: vision assessment, refraction, and then eye health assessment. There should ideally also be an instrument for measuring the pressure of your eyes, and there are different kinds of tonometers. That's the instrument for measuring pressure of the eyes. There are different kinds. There should be at least one. If there isn't one, then the practitioner should advise on where you can get your eye pressure measured. Something to be aware of is instant prescriptions. A proper eye exam takes time. A full eye exam will last anywhere between 20 and 40 minutes depending on what the practitioner is looking for, the cooperation of the patient, and also the kind of eye conditions that you're having. So these are some of the red flags to look out for. No explanation of findings. If the practitioner doesn't explain what they have found out, that's a red flag. There's no referral when it's needed, that's another red flag. No clinical records, that's a very big red flag. In healthcare, we have a saying that if it wasn't written, it wasn't done. So everything that is done in an eye exam has to be documented, and the documentation should be available and accessible. There are no identifiable qualifications of the practitioner. That's a big red flag. No matter how fancy the instrumentation is, you should be able to tell what the qualifications of the practitioner are. The goal of this video is not to criticize anyone. It's to let you, the client, know what to look out for in a proper eye exam, and to remind us practitioners to always be honest with ourselves and with our patients, so that in situations where we are not able to deliver a full eye exam, we should tell the patient that this is not complete and be able to advise on how they can get the rest of the eye exam. I hope you found that helpful, and thanks for watching.